evaluation, the vasculature. Yes, yes. Longitudinal section, left lobe. Again, this is the left lobe, the surface.
Here we can see the left lobe, ligamentum venosum, which is the echogenic line. فين ال cursor? Okay. Ligamentum venosum, and this is the caudate lobe. This is the IVC, and here we can see the left branch of portal vein and the left hepatic vein. And on tracing and scanning the left lobe of the liver, it is of homogeneous echo pattern, smooth surface, and no focal lesions could be seen.
And then
on starting is on a subcostal view. Here we can see the IVC.
yes.
The IVC, the right hepatic vein, middle hepatic vein. نفس كده جامد وخليه جوه. ما هي مكسوفة بس. Middle hepatic vein and left hepatic vein, and we can trace. Here we can see that there is a large solid hypoechoic focal lesion in segment 6, and when we try to see it from the intercostal space, here is the diaphragm, and we are starting to examine from the dome of the liver and scanning each intercostal space. And on scanning the lost space, we can see here we can see
Yes.
we can see a slightly exophatic isoechoic. I think it is isoechoic to
Yes.
hypoechoic,
Yes, isoechoic.
multilobulated.
Yes.
And we can see a capsule surrounding it, so it is well defined. But because of its echogenicity, it is not clear. But I will think it is have a clear margin. And on assessing for color Doppler examination, we can see that it is highly vascular,
Yes.
containing extensive intra-lesional vascular signals on Doppler examination. And when
Dr.
we
Yasmin,
can,
we are going to again to evaluate the lesion, the size, the site, the surface, then the vasculature. Okay?
yes, at first the site, this is segment 6 of the liver, when you can see the kidney in the view.
Segment 6, right?
Yes, it is
Okay.
segment 6 of the liver,
Okay.
and we can see what is specifically
It
characteristic.
is partly
in this-
exophatic.
Oh, yes,
right?
what is characteristic in this lesion than the other lesions, that it is exophatic. Part of the lesion is seen having a contour bulge outside the
Yes. Yes.
border of the liver.
Okay.
So the site is segment 6. The size we can freeze and we can measure.
Yes.
خدي نفس كده جامد وخدي. We can take from the highest diameter.
Yeah.
It measures around 4.9 by 3.8 centimeter. And what is characteristically in this lesion, you can see that it is
It is again
multilobulated
close to the
or,
close to the gallbladder
yes.
as well, right?
uh,
So I think
this is a good
right?
bladder.
in a way,
it's just
in some
below.
sections, it is related to the gallbladder, right?
Yes, yes. And it is multilobulated.
Yeah.
So regarding its
The surface is smooth,
smooth and multilobulated. And regarding
multilobulated,
its
yes.
echogenicity, it is isoechoic.
Okay.
And on assessing the vascularity, it
The
shows
vascularity is-
extensive intravascular lesional signals on Doppler
It is
examination.
hypervascular. What is the pattern of these vessels?
I think it is linear, not dotted. يعني there are more linear.
arterial or venous or both, because
yes,
it might
on-
differentiate between benign and malignant.
On adding a pulsed wave examination, there are
Yes, this
some
is
arterial signals,
arterial, hypervascular,
and
arterial,
this is high vascular.
hypervascular,
Yes.
And also it shows also venous pattern as well. So it has both arterial and venous, and mainly arterial, right?
Yes. بس
Does it show any invasion to a nearby vessel?
I will try to see its border. I think the right hepatic vein here and is reaching its lower end. I didn't think it is invading a vessel because this is the tip of the
Yes.
right hepatic vein, and it is
Yes.
displacing it only,
Yes.
not
Just
infiltrating it.
displacing the vein, but
Not
but
infiltrating
does
it.
not invade it.
Yes.
This is important point.
And on scanning the rest of the liver,
Yes,
to
the rest of
exclude
the
the
liver.
presence of any other concomitant hepatic focal lesion,
Yeah.
each space will be scanned from the dome of the liver.
Again,
Till
the liver
its
is not
anterior
cirrhotic, right?
Yes, the liver is not cirrhotic,
Mhm.
and I couldn't see any other focal lesions.
When you see that the liver is not cirrhotic, so this will increase the difficulty of the final diagnosis, of course. So because when you have a cirrhotic liver with a focal lesion, it is liver cancer until proved otherwise. So if you have a normal liver with the focal lesions, you have a lot of differential diagnosis. So because of the time, I think we reached that this patient is having an uncirrhotic liver, a single big lobulated focal lesion, hypervascular lesion. So we have to put some differential diagnosis according to our ultrasound examination, and then we have to call for a second opinion from the imaging. So, Dr. Yao, please, can you comment on this case? And we would like one of you to خليها دقيقة واحدة ياسمين خليها دقيقة واحدة حد يبص بس. Would you like to have another one to hands on, please? We have 10 minutes and we'll finish our workshop. If anyone would like to hands on? No one? Okay, Yasmin, خلاص. So let us have a discussion on this. Please come. Please. Would you kindly introduce yourself, please? Introduce yourself, please.
Kissy Henriette, coming from Ivory Coast.
Oh, you're welcome. Please, again, step by step, until we got the lesion.
You can start longitudinal.
No. Okay. First step. I don't see.
Yes,
For
this
the
is,
pancreas.
yes. Transverse section in the epigastrium.
Transverse. Yes.
Yes, very good. Left lobe, pancreas, longitudinal section, left lobe again.
Left and right.
Yes,
Longitudinal.
yes, very good.
And subcostal.
Subcostal with deep breath. خدي نفس
Mm.
جامد.
Oh.
أيوة.
Yeah.
Deep breath.
breaths. Okay.
Yes.
I can. The mass, the liver.
You can do a fine movement like this.
Okay.
نفس كده جامد بخليه جوه. This is the right hepatic vein, middle
Yes.
hepatic vein, and left hepatic vein,
Okay.
and we can see
Subcostal
This is the
approach
lesion in
with
the-
deep breath, and the whole right lobe here is very clear. The gallbladder here.
Okay. Intercostal. Yeah.
Good.
Don't forget gel.
This is the portal vein.
Okay.
Evaluation of the vessels of the liver is important. The portal vein and the hepatic veins is crucial in assessing any focal lesions of the liver, because we might see a portal vein invasion, hepatic veins invasion, and this would be one of the important staging workup and one of the important signs, ultrasound signs, that may favor the malignant behavior of the focal lesion.
Yes.
Okay, thank you very much. So I think this session showed the exact value of the ultrasound, how the ultrasound is an easy way of imaging, non-invasive. One of the benefits of the ultrasound, it is non-invasive, repeatable, relatively cheap as compared to other imaging modalities, and the new advanced machines, including the Doppler, the dynamic Doppler, and the use of the contrast media as well with the ultrasound, the Doppler, changing the equation of the diagnosis of the liver disease in general and hepatic focal lesions, and particularly hepatocellular carcinoma. I hope this workshop was an introductory for the value of the ultrasound. Please, I would like to thank all of you for participating at the workshop, the team of the ultrasound workshop, Professor Yao, Professor Ahmed Ramadan, Professor Dina, Professor Yasmin, Professor Tamer Elbaz, all of you. And before termination, I would like to evaluate this session, please. And if any questions before closing, I would be very happy. We have 5 minutes, please. We have 5 minutes left. Any question, please?
Thank you. We have some case of patient cirrhotic hepatitis B for the screening of HCC. Each 6 months ultrasound and alpha fetal or normal. 6 months later, the liver multinodular. I don't. Can you explain this? 6 months normal, ultrasound normal, 6 months.